My name is Patrick Buckley. I'm a sports medicine specialist and orthopedic surgeon with University Orthopaedic Associates. My office is in Wall Township, New Jersey, and my email is below. Today I'm going to talk about ACL injuries in female athletes, and certainly ACL injury is a pretty broad topic, but I'm going to try to focus on really the important aspects of this that pertain to female athletes. I have no disclosures. And by way of introduction, we're going to focus on really the mechanisms and risk factors that exist when you compare male and female athletes and try to help use that information to look at prevention strategies and different treatment options that exist specific to ACL injuries and ACL tears. Your ACL really acts in two main ways. The primary function is as a restraint to anterior tibial translation. And the secondary restraint is in rotational control of the knee. And it does this by having two main bundles, the anterior medial and the posterior lateral bundle, which really help to control translation as well as rotation of the knee. We also know that the ACL functions also in a proprioceptive way. Histology has found that there is some nerve tissue present in the ACL. And so, there is a proprioceptive function as well. And the ACL is a structure that lives inside of the knee, but does have a lining of synovium that does cover it. And when you start looking at epidemiology, you realize that ACL injury is pretty common. It's something that we hear a lot about in the lay press, and most people have heard of an ACL tear. But overall, as participation in sports has increased, this is an injury that we see more commonly, and we see it also more commonly in females when compared to males. And that discrepancy is something that really takes off after puberty. ACL injury is something that is most commonly a non-contact mechanism. So that means that it's usually a deceleration mechanism where the athlete is trying to slow down. They plant their foot and they go to turn. And then often that sequence of events can stress the ACL to the point of tearing. Most commonly, we see ACL tears when the knee is close to full extension rather than flexion. And really what this does is it puts more strain on the ACL. We often see that there's a valgus moment or a moment where the knee is closer to the body and the leg or the foot is kind of farther away from the body. And that combined with a rotational moment, really all stresses the knee and puts it at a higher risk of injury. And as we talked about, this is something that is very common. Really any sport that involves landing, pivoting, cutting, and you can list them here: gymnastics, soccer, basketball, field hockey, lacrosse, handball. They're all things that have a risk of ACL injury. But really any sport, this is possible in. And we start really trying to understand, the mechanics of an ACL injury. There's a couple studies to look at, and I think this was a study in 2009 that performed a video analysis of non-contact ACL injuries, and I think it really highlighted the positions of safety as well as positions of ACL injury. And in these injured athletes, they found that they had a significantly higher hip flexion angle when they tore their ACL. And really what that does is when you flex your hip, it kind of requires a compensatory extension of the knee. And that knee extension makes you disadvantaged to help protect your ACL. So in that position, your hamstring is not able to control that anterior translation. And often we end up in a more quadriceps dominant position, which can place the ACL at risk. And, we'll start to look at some of these factors that may predispose female athletes to ACL injury. And there's two main categories that we'll kind of look at. The first is extrinsic factors, or things outside of the athlete's body, or intrinsic factors, and we'll kind of go through these in the lists that we have presented here. So from an extrinsic factor, ACL injury risk has been thought, and a lot of literature has been tried to examine whether or not the type of surface that you're playing on, whether that be grass or turf or a court, whether that is tied to ACL injury risk. We've also looked at what type of shoes you wear, the cleats that you wear, the length of the cleat, and all of those things have been examined to try to see if that may predispose an athlete to, a higher risk of ACL injury. Some of the thought is that if there's more friction between your foot and the ground, that maybe that may predispose that valgus moment and that deceleration moment that may risk ACL injury. We've also looked at bracing of the knee and whether that could prophylactically or preventatively prevent an ACL injury. And really, the summary of this is that none of this has been proven in the literature as an independent risk factor for ACL injury. You'll see a lot of, for example, offensive linemen in the NFL wearing braces. And that's really, there's some data that may help with preventing MCL injury or the ligament on the inside, but no data has ever been proven that wearing a brace or any of these other extrinsic factors is an independent risk factor for ACL injury. So then we turn our attention really to the intrinsic factors, or the factors that are inherent to each athlete's body. And the first to look at is something called the Q angle. And this is really the overall alignment of the lower extremity. And we know that female athletes tend to have a higher Q angle, or basically more evidence of their knee kind of going in and their foot going out. And that angle is higher in females, and there's a thought that maybe that lateral or valgus moment may predispose athletes to ACL injury, but this has not really been borne out in the literature. Another thing to look at is really the overall joint laxity and I think, underneath of this laxity topic, understanding recurvatum or increased knee extension, I think is something that is really we're becoming more knowledgeable about over the last few years in orthopedics. We know that ACL injured female athletes do have an increased amount of recurvatum, and that can place them at a higher risk of ACL injury. This is important not only to understand ACL injury risk, but when you start talking about reconstruction, this is something that we really have to identify. Often an increased recurvatum or increased heel height test can signify that there are other structures in the knee that are injured, most importantly the posterolateral corner structures of the knee. And it's important not to miss those injuries, and so that you're reconstructing those at the same time of the ACL surgery. It also may help inform your graft choice somewhat. This is somewhat anecdotal, but you don't want to have a graft that could stretch out, and maybe a patellar tendon graft might be a better choice for a knee that has a significant amount of recurvatum to help stabilize that and prevent that hyperextension. We also know that ACL size is different between female and male athletes. Females do have a smaller cross-sectional area of their ACL, but these studies here really did not demonstrate any increased risk of ACL injury because of the size, so that has not been proven as an independent risk factor. But I think the meat of the talk, and really the thing that is important to look at, is how landing mechanics and the different biomechanics of the athlete can predispose them to injury. And then the next step of that is understanding how we could potentially reverse those landing mechanics and hopefully decrease the ACL injury risk. So overall, female athletes tend to land with higher valgus moments of the knee. So you can see here in this picture that on the left, that this is kind of a neutral alignment in a position where the athlete would land in a protective position, but landing on the picture on the right where the knees are in valgus really may stress the ACL and put them at higher risk of injury. We know that landing in knee extension also places an increased risk of the ACL. When you land in extension, you really put your hamstrings at a biomechanical disadvantage, and so it really can't dynamically help prevent anterior tibial translation. We also see that female athletes tend to have weaker hip abductors in their glute medius and other abductors of their hip, and that can predispose the athlete to ACL injury. And all of these risk factors, when you put them together, really result in increased shear and translation of the tibia moving forward on the femur. And those are all things that can ultimately end up tearing an ACL. So this is a graph that really kind of summarizes that. And on the left, we have positions of safety, which is neutral alignment, strong hip abductors, a knee that is not collapsing into valgus and not rotating when you land. And in comparison, a knee that is at risk of ACL injury is one that tends to collapse into valgus, tends to have rotational miscontrol of the tibia, and does have weak hip abductors, placing them at risk. And there's been a few studies that have really examined this. The first was in 2005, where Hewitt examined 205 female athletes and examined their landing mechanics. This was all done pre-season. And of those athletes, the 9 who unfortunately sustained an ACL injury did have significant posture and loading of their knee. They found significant increase in abduction or valgus moment when they landed, and that this increased valgus moment did predispose them to ACL injuries. And so they really focused on this abduction as a way to hopefully prevent ACL injury. The same group again did a video landing analysis in 2009, and they examined the lateral trunk angle as a way to predict ACL injury. And that they found that an increased trunk angle and an increased abduction moment, again, placed more valgus across the knee and did predict ACL injury risk. In 2015, Meyer examined knee abduction moments and found that if you had a force above 25 newtons, it had an increased risk of ACL injury of about 7%, compared to less than 1% if the value was below 25 newtons. So, the take home from this, and a couple studies I'm going to talk about in the future, really is that ACL injury risk is highest when you have hip flexion, the knee landing in full extension, and in a valgus moment that can place the injury or place the ACL at risk. So compared to males, as we talked about, females tend to land more erect with more knee valgus and more external rotation of their tibia. And this really highlights the fact that your lower extremity is a kinetic chain, and all of this starts in the core. To land efficiently and stably, it requires strong core, it requires a strong control of your glute and your hip abductors, and control of your knee dynamic stabilizers. So if you can land in a slightly bent position with your knees straight out in front of you and your feet balanced underneath of you, then you're biomechanically reducing your injury risk from ACL. This was a study in 2007 that looked at almost 300 collegiate athletes, and it found that core weakness did predict ACL knee injury. So, all of these things are combined, and I think this is something that really highlights the importance of looking at the kinetic chain and looking at the athlete really from the bottom up, and not just focusing on only quad control or hamstring strengthening, but looking at the overall strength of the athlete as a way to help predict ACL injury. So other intrinsic risk factors, are genetics. We do know that there is a family history of ACL, that there is a slightly higher increased risk of injuring your ACL. And a lot of research has begun to look at the different collagen genotypes. Collagen is what kind of your ACL is made up of, and is a building block that is present in the ACL. And we're beginning to understand that people who have certain, family history of ACL injury may have a higher risk of sustaining an ACL tear themselves. Other intrinsic risk factors have really looked at the hormones that may predispose a female athlete to injuring their ACL. They've tried to examine, the timing of ACL injury based on the menstrual cycle, and whether or not spikes in various hormones may predispose to some increased laxity of your ligament, and then ultimately ACL injury. At this time, there's really no data that this timing of the menstrual cycle has any effect on ACL injury, but certainly examining hormone levels such as relaxin or progesterone or estrogen is, I think, an important area of future research, and something that a lot of centers are examining. And we may know more about this in the future. And then certainly there's other anatomic factors such as the width of your intercondylar notch, the slope of the posterior tibia, as well as your motion in your foot, that all can play a role in the ACL injury risk that an athlete has. But when you try to put all of this together, you realize that it's probably not any one of these intrinsic factors that is predisposing an athlete to risk, but really it's multifactorial. And when you summarize the dynamic position that we're trying to avoid, we want athletes not to land in that knock knee position where their knee is in valgus, their leg is straightened out, and their hip flexion angle is increased. We want to avoid decreased hamstring strength, and we want to really maintain full hip, knee, and knee range of motion so that we can ultimately try to prevent ACL injury. And as we kind of switch gears here, and try to talk about prevention strategies, I think it's important to realize that, yes, we do want to strengthen the lower extremity, but overall, it's more than just strengthening. We really need to focus on proprioceptive type activities and exercises. And really what proprioception means is our ability of our body to know where our extremities are in space without actually seeing them or looking at them. So that's where the reflexes come in, where neuromuscular control comes in. And that's what can hopefully help prevent ACL injury if you can focus on that. And I'm going to go through a number of studies that have really aimed to try to prevent ACL injury and see what the lessons are that we can take away from those. So in 1999, Hewitt really did the first study that looked at neuromuscular training and its ability to reduce ACL injury risk. So they prospectively worked with high school female athletes for 6 weeks, 3 times a week, and did really an hour to an hour and a half at each session. And they found that they were able to reduce the ACL injury risk by 72%, which is a significant amount. And really what they did is they focused on techniques. They focused on education of the athletes so that they understood the things that they're trying to avoid when they land. And they taught plyometrics and other proprioceptive type exercises to work on decreasing the ACL injury risk. I think a couple things that this study began to show that other studies have echoed is that really the training should be done consistently. It should not be done just once a week, and they did this really 3 times a week. And the training needs to be repeated. So they followed this up and they kept the training going for 6 weeks. And really the goal would be that this is worked into kind of your general stretching program, at the beginning of practice or beginning of games, and that this is something that can be repeated and reinforced over and over again. In 2003, there was a study that looked at Norwegian handball players. It looked at almost 900 athletes, and they looked at intervening with ACL prevention strategies. So they didn't do anything for the first season, and then they implemented this ACL prevention strategy program, and they found a significant reduction in their non-contact ACL tears. So their ACLs went from 29 down to 23, down to 17 in the 3 seasons that they evaluated. As we kind of alluded to, certainly compliance is an issue. If you don't do the training, it's probably not going to help you very much. And I think this is the theme that we're going to continue to see moving forward. In 2005, Mandelbaum did a cohort study of female soccer players of over 1,000 athletes, and they did find a significant decrease in ACL tear incidence in the athletes that they worked with in kind of a neuromuscular training program. So, they found 6 tears in their ACL training group versus 67 in the untrained group. So certainly a significant drop in ACL injury risk. Similarly, a study done by Peterson examined German handball athletes, and again, they found that if they were able to work on a balance board, teach them how to jump, and more importantly, really land, work on proprioceptive exercises with a balance mat, that they were able to lower their ACL injury risk by 80%. More recently, in 2017, Hewitt did a targeted neuromuscular training that was, again, supervised, and they found that they were able to significantly improve the athlete, their hip control and the flexion angle of their trunk at landing. And that, again, this is all with the goal of decreasing the ACL injury risk. In 2017, Pollard, again, examined this in female athletes, and they found that over 12 weeks, if they were able to participate in neuromuscular training, they were able to improve their landing mechanics, their trunk flexion, and ultimately the amount of energy that goes through their hip and their knee when they land. And this is the whole goal here. This is the ideas that we're trying to teach athletes how to prevent, the positions that place their ACL at risk. And again, those positions are knee extension, a valgus moment on their knee, and hip flexion that ultimately places their body at a disadvantage and places it more likely that you could tear your ACL. So when you put all of this together, the American Academy of Orthopaedic Surgeons really would grade this as a moderate strength which is pretty good to say that we have really very good data to support neuromuscular training for athletes to help prevent ACL injuries. And you can place in kind of the different criteria for female athletes, that are competitive athletes that may have a high risk. And again, that our best data as a society from a AAOS is really to enroll these athletes in a supervised ACL prevention program. And again, as we alluded to earlier, the length of the program matters. So this study looked in 2012 at a program for 3 versus 9 months. And the programs that lasted longer, in the 9-month range, did have a better result. It's not that the 3 months didn't help, but as you're able to continue this out over time, it can reinforce the learning that's happened in the training and really make it second nature for the athlete rather than something they're thinking about each time. So certainly maintenance is an important part of all neuromuscular training programs. So, I think the putting this all together slide is that we want to do this in high-risk athletes, in patients who are high-level athletes and do have a high risk of tearing their ACL. And the important components of a program to prevent ACL injury is really to strengthen all of the parts of the kinetic chain. And so that goes from really the ground up. And we think a lot about lower extremity strengthening for ACL prevention, but really, focusing a lot on glute and hip abductor control. So that means a lot of squats, a lot of lunges, things like that can strengthen your glute and your hip muscles. Having a strong core certainly does impart significant control to the lower extremities. So if you are able to land upright and not with a hip flex position, that can prevent putting the knee at a decrease or at a disadvantage for ACL injury. We know that proprioceptive training is an important part of this, and we want to do this training, multiple times a week. So doing this once and then kind of, not coming back and reinforcing it really is not the idea here. We want to do this from the beginning of the season on. And then if we can work this into, the general warm-up, then I think overall that's something that would be kind of the holy grail here and something that we can do to help hopefully prevent ACL injury risk. This is something that's been done in soccer pretty successfully with a program called the FIFA 11. And this is an ACL injury prevention program that really seeks to educate not only athletes, but the coaches and the parents that are involved to have these athletes do really a 10 to 15 minute warm-up every day before practice, before games, and make this part of your kind of your typical warm-up that you're going to see that most teams are doing anyway. But what they're doing is a little different than what we had typically done probably growing up with jumping jacks and arm circles and things like that. This program focuses on core stabilizing. Muscle is really focusing on getting a strong core, so working on lunges, working on planks and other positions to try to stabilize and to strengthen those muscles. It works on proprioceptive training, dynamic stabilization, where you're able to really do single leg squats and single leg balance tests, and ultimately get these positions somewhat ingrained in the mind so that the muscle memory is to land with a flexed knee. It's to land with the knee that's not collapsing into valgus, and hopefully ultimately can prevent an ACL injury, allowing those dynamic control and the dynamic stabilizers to kick in and prevent that ACL from tearing. So I think in the future, the future is bright for this technology and for this training type programs to help hopefully prevent ACL injury. A lot of athletes and a lot of centers are looking at wearing different sensors that can hopefully evaluate the ACL and evaluate the lower extremity position at the time of ACL tear. But really what we need is going to be long-term studies that examine, ACL injury and look at those other intrinsic factors. I think that the hormonal levels is something that is a promising area of research that we may understand more about. And that as we look at longer term outcome studies, we'll probably identify and understand these risk factors better. But in summary, we know that female athletes are at a higher risk of ACL injury. There's a number of risk factors that we went through to try to understand really the ones where we can intervene. And I don't think it's any one single risk factor that we really need to focus on, but it's really a multifactorial list. And prevention strategies are effective, and they can identify, athletes that are at high risk and try to implement these training type programs to decrease ACL injury risk. And the training programs are really there to help teach the athlete how to land, help improve their rotational and dynamic control, strengthen not only the lower extremity muscles, but also the core muscles, their hip and glute abductor muscles. And really, when you put all of that together, you can significantly reduce the ACL injury. I think what we're learning is that getting this message out there is really important. And this is something that I think should be part of your general warm up for really every sport that you do. When you're going out and you're warming up, you're trying to get your muscles awake and have kind of a little bit of a warm up. That this is a program that you can identify and to implement pretty early on. So future studies will certainly help guide this prevention and treatment programs. And with that, I appreciate your attention. Again, if there's any questions, I'm happy to answer them. But overall, thank you very much. Be present in that athlete's body. When we generalize, female athletes do have an increased amount of hyperlaxity compared to their male counterparts. And this is something that changes after puberty. So often that laxity will go down significantly for males, but may continue and stay high for females. And when you examine female knees that do have increased laxity, we do see increased rotation, increased valgus moment, as well as anterior translation when you examine female athletes who have a higher amount of laxity. And ultimately, when you have more laxity in your knee, you really put more stress on the static restraints to that knee, and that is your ACL and other ligaments in your knee. And you also really require more dynamic control, and so that requires having good control from a muscle standpoint to try to provide stability to the knee. And you really have to compensate with better landing mechanics, better overall alignment in the provocative positions that may put your ACL at risk. And that's something we're going to talk about just here in a moment.